So for this first video, I'll be showing seated palpation of the different landmarks of the neck, as well as some cervical and thoracic range of motion techniques. So first I'm going to start with the range of motion techniques because it is a bit more complicated, so I wanted to get that one out of the way before we move to palpation, which is a little less complicated to do. So with cervical range of motion, I want to first stabilize the CT joint, so that way the only motion I'm getting is purely cervical. So palpating down for that C7, which typically is the first prominent figure you feel when you once you go to the lower cervical spine. Once I feel it, I go ahead and just add a downward distraction force to stabilize strictly the cervical joint. So first, with flexion, I'm going to ask the patient just to bend their head down, and then I'm going to add some overpressure using all of my hand. Is there any pain with that? Okay. Once I know that's fine, I can add some overpressure, and that's for flexion. For extension, I'm going to ask the patient to look up straight into the ceiling, and then adding overpressure. Any pain? Good. Okay. So for rotation, I'm going to have the patient rotate his head to the left, and then adding the overpressure along that plane. And I like to cup my hand kind of around the ear, so that way I'm not pushing anything too bony prominent, and it makes it easier. And I'm going to ask the patient to go ahead and rotate this way to the right, adding that overpressure. And then for the lateral side bend, lateral flexion, I'm going to have the patient laterally flex his head to his left, so go ahead and bring your left ear down to your left shoulder, stabilizing here, adding overpressure along the temple. And then for his right, I'm going to have him laterally side bend here, stabilize this shoulder, and laterally side bend. So for thoracic rotation, I strictly want thoracic spine motion. And if I don't stabilize his thighs, you can get some lumbar rotation in there as well. So first I'm going to have the patient cross his arms. And then I'm going to plant my leg here, so that way it kind of blocks off his lumbar rotation and I get strictly thoracic. So go ahead and rotate towards your left. I'm adding that overpressure, stabilizing along his shoulder. Any pain? Okay. Bring him back to neutral. And for the other side, I'm blocking off that right thigh, having him rotate to the right, stabilizing here. For overpressure, any pain? Good. So that is for cervical and thoracic range of motion. So next, we're going to look at the palpation of the different landmarks. So since the patient's already facing this way, I'm going to go ahead and present first rib and scalene muscles. So for first rib, I'm going to palpate along his clavicle. And once I feel the clavicle, I'm going to go immediately posterior to it and apply some pressure pretty deep. Probably doesn't feel good, does it? It is a rather tender bone. And then for scalenes, I'm going to go back even deeper, have the patient breathe deeply. At the very end, I feel some muscle contraction that indicates his scalenes. Turn around. And then for cervical paraspinals, after applying full pressure for stabilizing the head, going along the suboccipital fossa, I can press and glide down to feel his cervical paraspinals. And moving on from that, go ahead and put your right hand on your left shoulder for me. I can begin to palpate for his upper trapezius muscle, coming along that way. And if I move medial from the acromion, I should, because the upper trapezius is kind of out of the way, I'm able to palpate for the levator scap, which should be right here. I feel the tension, and I know that this is the spine of the scapula, and this should be the superior angle of the acromion, which is an area near the levator scapulae muscles. And then moving back down toward the spinous processes, I am now in the thoracic spine. Same idea with cervical paraspinals. For thoracic paraspinals, I can push, pull down, push, pull down, push, pull down. And I would continue this to get along the thoracic paraspinal muscles. And that is seated palpation and cervical and thoracic range of motion of the neck.